All right, today we're putting on our detective hats to solve a really fascinating medical puzzle. We're talking about a condition that's notoriously tricky to diagnose, and that's because its source is buried deep, deep within the body's core.
So let me ask you this. What if a patient comes in with a whole bunch of confusing symptoms, but every initial check, every simple test, just leads to a dead end? The real problem is hiding in a place that's incredibly hard to see, and honestly, even harder to suspect in the first place. That right there is the central challenge in the case we're about to crack.
Okay, so let's dive in and start where every medical investigation has to begin, with the patient and their really puzzling symptoms.
You see, this is what makes this case so tricky. These symptoms don't immediately point to one single thing. Flank pain? Okay, that could suggest a kidney issue. An unexplained fever? Well, that screams infection. But where? And a mass down in the groin? On their own, each one of these symptoms tells a totally different story. But when you put them all together, they create this really perplexing medical mystery.
So with the puzzle this confusing, the medical team can't just guess. They have to start a really methodical search for clues, ruling things out one by one until the truth starts to bubble to the surface.
The process is super logical. You start with a hands-on physical exam to find any physical signs. From there, you move to blood work to see what's happening on a cellular level. And then finally, you bring in the advanced imaging to get a direct look inside the body. Each step is designed to get us one step closer to the answer.
And boom, right away, we get our first major clue, the psoas sign. So during this specific physical test, a doctor will gently extend the patient's hip, which stretches that deep psoas muscle. If that simple movement causes a sharp pain, well, that is a massive hint that the problem is located right there, in or around that specific muscle. It's a huge piece of the puzzle.
Clue number 2 comes straight from the lab. The blood work comes back showing leukocytosis. Now that's just a fancy way of saying the patient's white blood cell count is through the roof. Their body is clearly in battle mode, fighting off some kind of infection. So this is crucial. We now know for sure there's an infection, and we have a really strong suspicion about where it is.
All right, with these two big clues in hand, it's time to bring in the heavy machinery. We need something that can literally see through tissue and bone to reveal this hidden culprit once and for all. And this is the moment of truth. An imaging scan, like a CT scan, provides the definitive clue. See, these machines take these incredibly detailed cross-sectional pictures of the body, and they let doctors digitally peel back the layers to see exactly what's going on deep inside, something no physical exam could ever reveal. And there it is. The diagnosis is a psoas abscess. It's basically a contained, walled-off collection of pus, the battlefield of that infection we saw in the blood work, and it is formed right inside that deep illiopsoas muscle group. The mystery of the pain is finally solved. So what does a doctor actually see on the screen? Well, healthy muscle tissue has a certain look, a certain density. But right in the middle of it, the scan shows this dark, well-defined pocket. The medical term for it is a focal hypodense lesion. Focal just means it's in one spot, and hypodense means it's less dense than the tissue around it. For our investigation, it's the smoking gun. It's the abscess itself.
So we know what it is. But the next logical question in any investigation is always why? I mean, where did this infection even come from in the first place?
Well, it turns out there are two main ways for the infection to get started. The first is what we call hematogenous, which is just a technical way of saying it traveled through the blood. So an infection from somewhere else in the body gets into the bloodstream and basically decides to settle down and set up shop in the psoas muscle. The second way is more direct. An infection from something right next door, like the spine or kidneys, just spreads straight into the muscle. And the most frequent uninvited guest in these cases? Staphylococcus aureus. You've probably heard of it as staph. It's a super common bacterium that often causes things like skin infections, but if it gets into the bloodstream, it can travel pretty much anywhere and cause big problems, like an abscess in the psoas.
Now, of course, certain conditions can make people more susceptible to this. Things like Crohn's disease, diabetes, or really any condition that compromises the immune system can make it harder for the body to fight off that initial infection. And there's also a really specific link to tuberculosis of the spine, where the infection can spread directly into the psoas muscle.
So, we've identified our culprit and we've traced its origins. The final step in this medical detective story is to deliver the solution and finally close the case.
And thankfully, the treatment is as direct as the diagnosis was complex. It's a really effective one-two punch. First, you have to drain the abscess to get that collection of pus out. This is often done percutaneously, which just means through the skin with a needle that's guided precisely by imaging, the very same tech that found the abscess to begin with. Then, second, the patient gets a strong course of antibiotics to wipe out any remaining bacteria and make sure that infection is gone for good.
And just like that, our investigation comes to an end. The psoas abscess is a perfect example of how combining that classic, old-school detective work with modern technology can solve a really deep-seated medical mystery. It kind of leaves you wondering, doesn't it? How many other mysteries are out there, just waiting to be solved, hidden just out of sight? Thanks for joining me for this explanation.